Okay, everybody, this is the pseudo sciatica portion of the pre-course where we're going over session flow, stretch flow for pseudo sciatica. So it's a lot of things that we're going to do. It's going to be very focused on piriformis, glutes, lower back, hips, hamstrings, even quads. So first, what is pseudo sciatica? It is nerve irritation from the sciatic nerve, and most likely it is coming from the piriformis or glutes themselves. It is non-disc related. When it is disc related, then it is actually sciatica. It is best that your client gets an accurate testing for this. If they're just experiencing very localized pain, most likely it is pseudo sciatica. But if the pain is radiating down the leg all the way to the foot past the knees, most likely it is actually sciatica. And then when you refer them out, make sure you have a chiropractor that you can refer to so they can get some x-rays, or they can go to the hospital, emergency med, wherever they can go for some x-rays to get a proper diagnosis. All right, so I want to show you a test for if the sciatic nerve pain is coming from the piriformis. We're going to start off with just a piriformis stretch, seated stretch. All you're going to do is cross your leg just like that. You're going to sit up for me and then just lean over. And if he feels any type of tangling, any type of pain in the glute or even in the hamstring, do you feel anything? You shouldn't. Okay, good. It's a good stretch, isn't it? So if they feel any type of pain, irritation in the glutes, in the hamstring, most likely it is pseudo sciatica. All right. So to start off a client who is experiencing this, I want to start them prone. So most likely, if you're in the level 2 portion of stretch therapy, we already went over assessment of the hips and the quads. I'm going to warm up my client first. So if you have any type of massage gun, you're going to put it in the lowest setting, and you're not going to put too much pressure into the muscles. You're going to put very little pressure, but just enough to get some vibration. First, I'm going to start with the QL. I'm not digging in. I'm very surface level just to get some blood flow to the area and to also increase any type of, or decrease any type of pain sensation in muscles. I get the glutes. I get the top of the hamstrings. You can bring their leg up, and as you're always bring it down. I'm just going to get the whole chain. So also the gastrocs. Even the bottom of the feet, because that nerve runs all the way down to the feet. Okay. So once you warm all that up, just like in our level 1, we'll pretty much go through the routine for lower body, but mostly focusing on the deep 6, definitely the piriformis, the glutes, the IT band, and hamstrings. Warm up the hip. You're going to lift that leg up, bring your hand underneath that knee. Make sure you're in a really good standing position before you start. Rotate that knee out. bring it to your hip. Now you can rotate and walk forward, bringing that hip into flexion. We're going to take our time. Now, I've worked with a lot of patients with sciatic nerve pain or irritation, and these stretches, within a couple of sessions, their irritation is gone. Even though I put them on a 3-month program. Bring it right here. We can start in the QL as it's in a short position and just put some pressure into that QL. We're also going to elongate the QL later on. Then we can hit the top of the glutes. Instead of using your fingers, you can use your forearms. Now, when working the glutes, you want to go in towards the midline of the body, okay? Do not ever pull the glutes out, because that is not a good sensation for your client. So you want to pull those cheeks in, okay? So when I'm pressing down, I'm pressing in. Always keep a rounded movement into my compressions. I never press straight down, because you want these sensations to feel good. And as I warm up the glutes, I can get to that piriformis or from the sacrum, go a couple of finger lengths out, and then you got the piriformis. You can move that piriformis out the way. Do not push straight down, because then you might hit that sciatic nerve. Right, Brad? Mm-hmm. So we want to kind of scoop it away from that nerve. As I use my arm to push, we can get some mobilization in. Get it through the feet. Get that whole chain. Feel for any type of sticky points in the feet as you bring it out. His feel pretty good.
I'm feeling it more in my quad, towards the knee. A little bit of IT band in there.
Good. We could bring that leg out. We want to create some space in this joint right here, so we can bring that leg down. As that leg is down, I'm bringing my knee right onto his leg. My forearm that is close to the body is going to be right in that joint. And then my other hand is on top of his knee. And I'm just going to pretty much press out this way to create some space. I'm pressing my knee to rotate his leg. Then we can add a PNF cycle by him pressing his ankle up towards the ceiling. Always against resistance. And let it go. There we go.
Better wording would be shin into shin.
Shin into shin. Pressure. And let it go. And then ease them back into position. Okay. We can get some more external rotation. Look, you can bring your knee into this, pin down the glute and the piriformis a little bit. I'm still pressing in towards his midline, and then externally rotating the leg I'm not putting too much pressure through my knee. You can add a PNF cycle, rotating in, rotate your ankle in towards your body. Let it go. Boom. Also, what I found with people with sciatic nerve pain, just shortening the muscles can actually relieve tension off of that nerve. So doing quad stretches, front of the hip stretches can actually help relieve that tension off the nerve. So we're going to go into the quads. You can get on top of the table. I like to bring my hand right here. I am not using my upper body to push. I'm using my whole body to push. I'm just leaning into there. And then the PNF cycle for this is just for them to try to straighten out their leg and release. Good. You can shorten even more. Kick out right here for me. Let it go. Kick out right here for me. And release. For demonstration purposes only, I'm not holding it that long. And then, if you want to get the top of the quad more psoas, if you have a, no, I don't have a half roller, it's in my car. But if you have a half roller, you can place it right above their knee to lift that leg up, or you can bring your knee and lift their leg up. Now their glutes are shortened, taking that pressure off of their nerve, and you can bring that leg in. You don't have to bring it all the way in. And just right there, they can press their knee down towards the table and let it go. To get a little deeper into that stretch in particular, you come on top of the table. Make sure your legs, your right leg, if you're on the right side of their body, right leg is at the top of the iliac crest. Other leg is up into a lunge. You can pretty much grab right here, bring their foot right into your armpit. And now we have a good motion to bring them more into extension. You can put pressure right into their QL. You have them give you a big deep breath in and exhale. As they exhale, you move up, getting deeper into that stretch. And then right there, they can press their knee down and let it go. And then gently get them out of that position. Now you can go to the other side of the table, keeping in contact. You can grab their knee. Now we're going to get a rotation movement in, still shortening their glutes and getting a good stretch on the front side. So I am square. All I'm going to do is open up my body as they open up. If they're not able to bend their knee because their quads are very tight, you can extend. Okay? So meet them where they are. I'm going to bring my hand right here so that when I move, they move. You can get some hip rotations in. Come back. Bring your hand onto the lower parts of their ribs to get a deeper rotation. And they're going to breathe into your hands. Deep breath. And exhale. As they exhale, you're going to slightly rotate out. If that other leg is moving, bring your leg up. And then we're going to get into the QL. Cross and down. Now we can get into that QL, glute, and IT band, even TFL, okay? So we can go straight down into the QL, but I'm still rounding out while still having pressure on the glutes. So I'm doing a good 2-for-1 right now. And just mobilize. Oh, that knee is not stable. To get a deeper stretch, bring their leg in. And then they can kick out into your side and let it go. And just guide them back over. And to get them back into center, bring that leg out, grab the knee, and wiggle, wiggle, wiggle. Okay, so that is a good way. Make sure you do the same thing on the other side. Do not skip that. That is very important. While you're performing, especially the compression and the stretches, make sure that your clients are communicating with you. Be honest. Most of my clients, they're going to let me know. They're very verbal. They're like, ooh, ooh, yeah, they're right there. Oh, no, okay. Just make sure that your communication is open with your clients. If they're very quiet, ask them questions throughout each movement. That is very important. All right, I want to get you onto your back.